On behalf of the Asia-Europe Foundation, AMR Clinical Reference Center, and the Ministry of Foreign Affairs of Japan, it is my great pleasure to welcome you to the universal health coverage in an era of antimicrobial resistance and pandemic conference.
1, 2, 3.
AMR issue is a common challenge for Asians and Europeans and beyond to the people of the entire world.
Just as the UHC and the pandemic are interconnected, which we all learned from our experience during COVID-19, we cannot attain UHC without addressing AMR, and we cannot address AMR without attaining UHC.
We need a very strong political commitment. So organizations like the Asia-Europe Foundation can raise awareness among countries in Asia and Europe at the heads of government level so that they can be aware of AMR as a very serious global public health challenge.
The whole point is that you have to come together. So you often find that, let's say, the health sector tries to solve the issue alone, which doesn't work because actually the root cause for resistance comes from multiple sectors, also from the human sector, but also we have this issue in the veterinary sector, in the environment sector. Then for solutions, we need the industry.
They should give awareness to the masses on the size of the problem of AMR. On the other hand, the decision makers and the policy makers needs to be contacted. So we have to build a case for the policy makers to recognize the importance of AMR and to recognize if nothing is done, what is the cost involved, and to recognize if something is done, what will be the benefit to the population.
Multilateral organizations play a huge role in the combat against this silent pandemic called AMR. Through the collaborations and strengthened consensus among the different jurisdictions, participating countries attending this kind of conference, high-level meetings.
ASEF can work with countries, but country is the definitive partner. Then ASEF can support, may convene technical workshop further at the country level, or 3 or 4 countries join together and ASEF coordinate, bring in expertise from WHO, from FAO, from OIE, etc.
Bringing experts together, policymakers, academia, people from governments, industry, and so on and so forth. So all important stakeholders, and exchange information on what works and what does not work. And then really draw lessons from that to see what actually can be activated and intensified in terms of later on implementing actions at national level or even at subnational level in a more comprehensive way.
I think some of the next steps that we can do is to come up with some concrete activities so that we can actually work on small problems. We can't an instant try to solve everything. But if we can develop some specific activities that we can work together, that will be the catalyst or the nidus for us to learn how to work closely with one another and to get some small successes. And we can build on that to address then the global problem of antimicrobial resistance.
I think one very important thing that we have ahead of us is the UN high-level meeting in the UN General Assembly in 2024 on AMR. The meeting in itself, of course, is just a meeting, but this is a chance we have to assure real ambitious commitments of the governments. And I think one very important contribution of the ASEF would be to bring the Asian and European governments together and show this strong partnership and the broad commitment behind this.
Talking about the next step, right after this is
Now we're in Tokyo and we are in Japan and we are having a G7 summit in this coming May. And hopefully we can, put all the recommendation or, the document coming out from the event into the agenda of the G7 Tokyo. Hopefully, we'll do our best.